I'd like to call the City of Franklin Board of Health meeting to order April 14th, 2025. I'm glad to be with everybody here. I had surgery and it was very successful, and I'm getting stronger every day. Roll call, I believe everybody is here, but just because we have a new alderperson, I want everybody to go around and just introduce themselves. So my name is Henry Winchleski. I am a retired general dentist, and I chair the Board of Health. I've been lived in the City of Franklin for probably around 30-some years now.
Nice to meet you. Wade Husted. I'm also a retired pharmacist from Walgreens, and I've lived in Franklin since 2010. Oh, okay. That's nice to meet you. Yeah.
I'm the guy that's leaving. I've been an alderman for 9 years, and I served on committees for about 5 years before that. So we're talking about maybe 15 years total that I've been in government. And I've just decided to downsize my political career and have some quality time with my wife without worrying about meetings and what's happening this week and what can we try to do this week, working in the different schedules. So it's going to be a nice time for us. And I do plan on catching things on YouTube or catching the recordings, so I'm going to be watching everybody.
Wow. Well, hello. I'm Pat Nissen, and I am a retired nurse, and I've been on the Board of Health. Henry?
30-some years.
Yeah, at least. And I don't know. I'm just glad to still be here, I guess.
Yeah, I'm glad to have you.
Hi, I'm Patty Golden. I'm a family practitioner. I've practiced in the community for about 23 years and live in the community as well. And I'm, how many years?
So many. We need to get a historic scroll out for everyone who's served wonderfully.
Liaison for
Since
the
John.
medical board.
I just
Yeah.
looked at it
Yeah.
the other day.
Yeah, it's been a while.
Yeah.
So.
Amy Marzofka. I've been a member since 2020 when my husband and I moved here to Franklin. And my background's in public health. I currently work for Ascension as a clinical informaticist.
Cool. I'm Rebecca Eberhardt. This is my first Board of Health meeting. I'm a nurse. I've been a nurse for about 25 years, and I currently work for Advocate Health. I used to work with Pat at Sinai way back in the day. I'm currently at West Dallas as their Magnet Program Manager, which is a nursing excellence program.
Great. I'm Lauren Gottlieb. I'm the health officer for the City of Franklin, so I serve here as a non-voting member, and I'm welcoming in my 10th year at the City of Franklin later this year.
Jim Rudlevich, I'm a retired orthopedic surgeon. I've been living in Franklin since 1979. Been practicing over 50 years. I was one of the 20 people that started the Midwest Orthopedic Surgical Hospital. And this is about my second year, I believe, starting my second year at the health department. I really wanted to give back to the community. I've been involved somewhat with the community. I've been a Southside orthopedic surgeon, and so mostly at St. Luke's, but then recently I retired in the 2020. The good Lord was looking after me. After that, they had the epidemic. I pulled the plug just at the right time. Otherwise, I would have had an overhead that I couldn't really meet. But looking forward to contributing to this committee.
Thank you.
Thank you.
We need approval of the minutes for January, and I cannot believe I was not here.
Okay.
Move
Yeah,
to
the
approve.
report thing.
I'll second it.
Okay, is there any discussion? Hearing none, all in favor of approval of the minutes from January 13th? Say aye.
Aye.
Okay, that's unanimous. Any? Well, any comments from our citizen? He is not officially yet.
No comments from me.
Okay. Any unfinished business?
There's no unfinished business.
Okay, then we're going to go right into new business and the administrative update. Public Health Department Annual Report.
All right, thank you. And I actually have a few other things to note that aren't lettered out here below, but first, I'll start with the conversation that you and I have had now about a month ago.
Oh, yes.
Coming up in May is the Health Department's DHS 140 review, which is when the state comes in and verifies that the Health Department is meeting all the marks that they're supposed to, delivering the services adequately, and you can then indicate to the state which designation of level health department you wish to be. So there's a level 1 health department, a level 2, which is what we currently are, and a level 3. And this year we have decided to go for the level 3 designation, so moving ourselves up a level from 2 to 3. A variety of different reasons went into that, but some of the things that a level 3 health department reflects is a more robust environmental health program than we've had over the last decade, focusing on lead, radon, environmental health hazards, our DATCAP licensing program, positioning ourselves as a public health strategist. So with the ushering in of our new public health strategist from specialist role, that has set us up for success, as well as our past involvement in the community health assessment and really playing as a key convener for public health partners. And we're really looking forward to it. So we don't see this as an increase in our workload because we've been operating in this structure for a couple years now. And additionally, my qualifications as a health officer allows us to go for the level 3 designation, and we're excited for the opportunity. So we wanted to bring it to the board today to make sure.
I did receive a letter from the Department, I believe, of Health and Human Services that accepted you as qualified to lead a level 3. So
Yes.
Congratulations.
Thank you. So that will be the second week in May, and Henry plans to sit with us in that review. And myself and then staff will come in and out of the meeting as we answer questions and talk about our services. The review in general has gone from more of widget counting, which has been decades past, to now a more robust narrative where you explain what you're doing and then they're ensuring that you're meeting and succeeding in what you should be delivering to the community. So we have that coming up in about a month.
Is there any cost involved when you go from a 2 to a 3?
There is not, but hopefully a cost benefit that will get a little bit increase in grant award funding. So there's very complex formulas that go into the funding, and it's minimal, but it's still worth noting that we will get hopefully more funding when we become a level 3.
So is that the one benefit to being a higher level health department?
And also to have that stamp of approval that you're doing the highest level of possible service.
You did name neighborhoods that are also level 3?
Almost all other health departments are a level 3, with the exception of Hales Corners, and I believe that might be all in southeastern Milwaukee County. Mm-hmm.
So we're keeping up with the Joneses.
And it's a long time coming,
Yeah.
so I'm excited to have the opportunity next
We
month.
needed an administrator that had, I think, a master's, and we did not have that in the past, so we couldn't even apply for it.
All right, and then another piece of administrative business I have is minimal, but every year or every few years we update the hanging in our health department waiting room to reflect who our current staff are and then our current Board of Health. So if by the end of the day or end of the meeting you can sign your name on the Board of Health side, I'll leave it
You
at
can
the
just
front
pass it
by.
around and-
That sounds good.
Sure.
And this is the special pen
Oh, yes.
to keep it consistent, so please use that. Okay, and now on to the Health Department Annual Report. So thank you for your patience with that. Similar to last year, bringing this to you in near final format. So this is a draft. It won't be officially final until we take it to council and present it. So if you see any changes, it will be in our table of contents and alignment of page numbers. But we took this opportunity to reflect back on the successful year of the Franklin Health Department. We tried to keep it consistent to former years of the structure that it followed. So it'll begin with an introduction of both our staff and you all as our Board of Health members, and then a little insights into foundational services and statutes, because that's a piece that I don't know that a lot of community members know or deeply understand. So we lay that out for the reader. And then talk about our community health assessment and improvement planning. So that assessment that we do every 3 to 5 years, where we do surveying of the community and focus groups to form our initiatives, and then work as a Franklin Health Collaborative to deliver on those. So you'll hear us refer to that as our CHIP group, which will be a key part of our level 3 health department status. Community health statistics. As a department, we review birth and death records and get some other key vital statistics, so we laid that out for the first time this year. Communicable disease control, giving an overview of really what we do as a health department with communicable disease, which you all hear regularly, but for the general reader to understand case management and follow-up. Environmental health, so we touched on this a little bit in depth at our last meeting, but talking about the food safety, license establishment, and then going beyond that to radon, lead, rabies. Maternal child health and the community outreach we do about that, car seat inspections, and key events. And this year, not in this report because we technically launched it in 2025, but will be the welcome baby kits that we'll be sending to all new babies in the city. Chronic disease and injury prevention, so a lot of that is older adult programming, substance misuse prevention, with the cornerstone of that being Bullish and Franklin and the great efforts of the volunteer group. Access to and linkage with care, which is a key piece of the health department to assist people with social service referrals and linkages to community resources. Public health preparedness, another item that our health department really wanted to highlight because we play a pivotal role in that here in Franklin, but I think that mostly lives under the radar. So pulling that to the reader's attention. And then lastly, highlighting the great volunteers that we've had throughout 2024 in the health department, including key interns. So we had a lot of students come within our doors who had really wonderful projects, and we wanted to make sure to touch a thank you with that.
Do you have any interns now?
We are ramping up our intern involvement. So we just had 2 students reach out. We had a UW La Crosse student reach out and one other UW-Madison student. And then we do have an AHEC intern locked in for the summer. But we're debating if we have capacity to take on 2 additional interns over the course of summer into fall. So we'll see about that. But it's a great way to offset the tremendous amount of workload of the staff and then also build the public health workforce that will be coming into the field. So we greatly value it.
Does anybody have any questions on the annual report?
When will this come before council?
Hopefully at the next council meeting.
Not tomorrow?
No, the
The next one.
yes, the 3rd. Yes. Yes. So then it'll be locked in before our review.
Our meeting in May. Great. That's the meeting here.
Correct.
Do we need to
Anything?
vote to move it forward?
We can.
We
yeah,
have
ask for a vote.
historically done that.
Sure. So we're looking for a vote to move the annual report, the draft of the annual report forward to not this meeting, but the next board meeting.
To council.
Council, yes, the council meeting. All in favor, say aye.
Aye.
Anyone opposed? Then mark it as unanimous.
Perfect. Okay.
Okay. Anything else under administrative updates? Then we'll go right into the communicable disease report.
All right, moving forward in your packet, you'll notice the Franklin Quarterly Communicable Disease Report. So that's that chart that we reconvened into making at the end or mid last year. So in the first column, those are Franklin-specific numbers, which numbers under 5 we suppress for privacy. And then Milwaukee as a whole is on the right-hand side, just to give you a little bit of context. So City of Milwaukee.
Just so you also, so you know, Franklin also includes the House of Correction.
Oh,
Yes.
okay.
Thank you.
Yep,
So some of these numbers look, wow.
Good information.
yeah, right.
Mm-hmm. Yes, so we've been busy doing communicable disease follow-up, and we included in our annual report this year that it takes several hours per case typically for one of our public health staff to follow up on a communicable disease, just to paint a little bit more clear of a picture of what that looks like. So that'll usually consist of us talking to the provider's office or their care team, the patient themselves, possible contacting partners, and conversations there about treatment. So there's a highlight of communicable disease on the chart here. And then also you'll notice in the second page of your Franklin Health Department Board of Health report, which is the next packet, just that typical chart that we pulled together to show the percentage of STIs versus respiratory versus others. And I'll save a measles update for the next section that we get to.
Are there any cases?
There are not,
Okay.
knock on wood, luckily, but worth an update nonetheless.
Okay. Just asking Pat, have you seen, no, still pretty high,
For,
influenza?
we're still getting them. I think the interesting thing is though, because you can test at home, we're probably not getting as many reported positives. But it's still around, so
I heard
For you,
hospitalizations
careful.
were up a bit, yeah.
yeah.
Anybody have any comments on communicable diseases? If not, we will go into the health department program updates and start with community initiatives.
All right, so for case management, one of the main things we're doing is preparing for measles messaging in a potential measles case
Correct.
locally or in Wisconsin. So we're currently not noting any cases in the state of Wisconsin, but there is an outbreak within the country and we're closely monitoring it. Franklin Health Department nursing staff and then the Franklin Health Department general team is putting together correspondence to have some increased communication with the school district, also daycares, just to identify that MMR vaccine is a primary way to, the most effective way to protect yourself against measles. Doing increased messaging around WER lookup, so how you can look up your immunization status so that people can be in a state of readiness and not as much panic if and when we were to get a case in Wisconsin. So a lot of just general information sharing right now. We've had a few questions trickle in, but there isn't so much public interest around it, but just monitoring it closely.
Was there any resistance in, say, people getting the immunization?
Well, we're the second lowest immunized in the country as a state in Wisconsin. So we have a very low MMR vaccine rate in Wisconsin, so there's a lot of room for improvement.
How about Franklin itself?
Franklin itself, I don't have that number. We do have a closer eye on school numbers, but not the general population. But I did print these for everyone because I thought you might be interested in that. So these maps here indicate Wisconsin, counties in Wisconsin, and the percentage of different populations with MMR vaccine. So I'll just pass that around for you to view.
Is there a reason for it? The resistance that we have inquired?
I'm not sure of the
Yeah,
deep root cause of Wisconsin as a whole, but if you have any insights on that, Dr. Golden?
No, I mean, it's, I would say the majority of our appointments are spent really trying to justify what we do and why we do it. Really trying to tackle the false information that is out there. It's exhausting. And yeah, I will say many of our pediatricians have never had to fight so hard to immunize kids as we've had to now.
That always used to be certain populations.
We have a program to show what the disease looks like.
Yeah. Yeah, I mean,
Had to be
the American
again-
Academy of Pediatrics and the American Academy of Family Practice, even ACOG, everyone has amazing information, and we're showing pictures and we're sharing stories, and whether they choose to believe it or not is, it's all.
There's some way we could go into the schools and get, the people that way, get it the back door into the families by showing the children what measles looks like and polio looks like, I mean, I was a physician. The first acute case of polio I had to be in Vietnam to see it.
Yeah.
I remember I was one of the first to be immunized under Salvin and Salk, I should say, in the early 50s. I mean, we were quarantined like we were with COVID. Remember those days? And it's scary.
Mm-hmm.
Sometimes a picture is worth more than 1,000 words.
Mm-hmm.
Seems like
Yeah,
it's
I appreciate your
predominantly
advice.
rural too.
Yeah.
Among other diseases
Mm-hmm.
back in the day.
So there
Among others.
are a number of people who refuse.
Well,
What-
and the
what-
problem is right, so the parents are making the decisions.
Yeah,
So we are educating the parents, we're showing them pictures of the diseases, we're showing outcomes and all of that. I mean, the data's all out there and we're handing it and showing and it's still,
wow.
yeah,
I mean, there wasn't a day when I had a young child that
I know.
we questioned that. You know, it was
I think there was a lot of
the
trust,
thing to
right?
do.
Like
Yeah,
what your
let the
clinician
pediatrician.
sat and talked to you
recommended
about,
it.
and now post-COVID, it's just a different,
Wow.
We also have physicians, also, Dr. Roll, he was a Canadian who was against immunizations because of the mercury and aluminum that were used in the vaccines, supposedly, that would cause neurologic problems. Crazy. Guy came from Canada. In fact, the book he read was Judas Dentistry. You probably read about it.
The guy from England.
Yeah. He's
The
actually
Lancet,
from,
yeah.
actually from, he was trained in Victoria, University of Victoria, in British Columbia. Canadian, a meatball. But what are you gonna do? And people read that stuff. It's crazy.
Yes. It's an uphill battle, so continuing to share messages, educate, facts, continuing to have community partner conversations and push messages out of our department as much as we can, access and linkage to vaccine.
You don't really have to, there's no restrictions to register for students in schools anymore. In the past, you'd have to have these immunizations in order to go to school. Do they do that anymore?
Yes, to an extent, yes. They should have
You
their
have to have
immunizations.
like a religious release. You have to have some type of release. Yeah.
Okay.
So we'll see. Hopefully we continue to have positive news on the measles front when we meet again.
Yes.
But the next point, AV screenings. The health department was in the elementary schools again this year to partner with the school district to do audiovisual screenings.
What 8 grades?
Kindergarten, second and fourth. Yusuf, Alderman Hassan, thank you for your assistance as a volunteer. So we are lucky to have a lot of community volunteers that help support the effort, both through our Franklin Health Department volunteer registry and then the Lions Club. Always helps because one of their missions is Kids First Glasses. So they help provide a linkage to affordable glasses for a few families who might need it. So we've done hundreds and hundreds of screenings for those elementary school students, and we've wrapped it up, and it was a
The
success.
last report said that we'd received 2 inquiries about funding for glasses.
Good.
Because that's a letter that's in the packet that they receive when they get the test, that we will, the Lions Club, Noon Lions, I don't know if the evening or Lionesses do, but I know the Noon Lions, will help the family buy glasses. So, or assist the family. So we've had 2 inquiries so far on people that have shown as being needy with glasses, so
Yeah.
maybe we'll get some more.
Yeah, it's a great way to
The testing
continue the
is just
loop.
ended now, right?
It's ended, yes.
Yes.
I would anticipate people are still going in, though, for their eye doctor screenings. I wouldn't think it would be simultaneous, so you'll probably see a few more trickle in. Okay, Light Unite Red was at the end of last month, and that is when the mayor made a proclamation for the month to be Light Unite Red. Well, the week, Light Unite Red Week. Residents were encouraged to use red as a symbol for substance misuse prevention support. and the Volition Franklin coordinator Megan and our health department coordinated a Wear Red Day here at the city, as well as the students did through Volition Franklin Youth at the high school. And we hosted our first Gloga event with the YMCA. So one of our coalition members had wanted to do this probably now over 5 years ago, and we've always tried to figure out how we would make it work. And the YMCA was willing to donate the yoga class, and so Volition Franklin and the health department helped support it, and it was an amazing turnout. A couple dozen people registered. It was anyone over, I believe, 12 or 13, whatever the YMCA's lowest limit of ages to be allowed in the facility.
That's the Bristol Y here.
Yes, the Franklin YMCA.
Did the YMCA provide yoga instructors?
They did.
Really?
Yes, and then Volition Franklin had mocktail recipes and a mocktail, and there was food and snacks. So it was a great event, and we're hoping to make it annual. So stay tuned.
Did you contact Trevor? Is that who you?
It was, yes. Okay, and then the Franklin Health Collaborative, who Trevor's a part of, so the YMCA is one of the organizations who sit around the table for the Franklin Health Collaborative, which is our CHIP group, our Community Health Improvement Plan group. We had our first meeting of the year, so we meet quarterly. And that was more or less to just set the efforts, make sure that we were all set for initiatives and get the ball rolling for this year. And then we also were at Multicultural Club Night at the school. Volition Franklin and the health department had a table, and we've been striving to collect increased data around parent perception or general perception around alcohol consumption. And we received over 100 surveys around cultural beliefs of alcohol and Franklin's alcohol culture.
Who did these surveys?
People at the Multicultural Night. So it was high school and high school age parents.
And the parents? Oh.
Yes, it was a great response. Unanticipated. We didn't know how popular it would be in like a fast-paced event. Yeah. So that was great. And then we've hosted blood pressure clinics. So for Heart Health Month, we've increased pop-ups for blood pressure tables to meet people where they're at and provide blood pressure screenings. Anyone can walk in during business hours to the health department, and we do blood pressure screens, but we made a point to increase the blood pressure awareness and prevalence for the month of February. And then you'll also see, as I'm talking, your report highlights more key initiatives, but those are just some of the ones I wanted to pull out to discuss for our programmatic updates.
If there's nothing else under the community initiatives, we're going to go into presentations. There's quite a few.
There are, so also didn't want to miss any, which is why I sub-bulleted them all. But Volition Franklin and the health department were invited to be a presenter at the CADCA National Leadership Forum in DC in February. So we were able to talk about the strengths of local partnerships to drive forward prevention efforts. So that was wonderful. We have, upcoming is a 2025 Healthy Aging Summit poster presenter. So we'll be at that conference presenting on some of the evidence-based programming that we're doing through the county that reaches older adults. We also held a heart health presentation for community members at the YMCA, so that's separate than the yoga, but an opportunity to have people come in and learn about heart healthy decisions. This one's unique in that Optimist Club invited us to come in and do a training on Narcan. So trained health department staff were able to attend and provide the training to Optimist Club members.
Do they have samples too?
Yeah, anyone who gets trained is able to take a Narcan kit, which is 2 doses. And then we also offer walk-in training at the health department. So if someone comes, we can take 5-ish minutes to either come across the hall or do it right at the counter and teach anyone who's interested. This is always a hit, and this is a teaser because we're going to send the email out this week to you all. But the tobacco prevention poster contest has kicked off, and the best day of our year has happened almost, come and gone already, where the students turn in their artwork. So we've received over 400 submissions from Forest Park students. And really our pride as well is that now we include Indian Community School. And we were able to get 30 submissions from ICS. So those are going out to community leaders for judges, which include the Board of Health. So that email will be hitting your inbox this
Will
week.
it be displayed anywhere?
Traditionally, we used to do it at Showtime.
Well, before we had billboards, but
Yeah, right. We have some history books of that. Now we've changed it to, in 2020, so during COVID, we changed it to social media ads, which actually has received a good response. So that plan is right now to stay with that. But we do print off a hard copy for the students of their poster. They do it on a long paper form. And then we present it at the Franklin School Board and then the ICS
what are the awards
admin
this year?
meeting. Oh gosh, you're
I'm
really
sorry.
testing my memory, but it's quite great. I can't quite remember the dollar amount, but it's
Is
like
it all monetary?
a pretty hefty gift card to winners. And then typically it's also been cousin subs
Okay.
certificates for those who participated. But we'll have to check with Megan on that one.
Okay.
And then wrapping it up with Franklin High School presentations. So Volition Franklin went in and presented to students during the day on substance misuse prevention, as well as the health department went in to host a nutrition presentation during the school day to a class. And then we also co-hosted with the police department Youth Drug Trends Parent Night. So we've been training teachers during their staff development days on youth drug trends, and it had such an incredible response that they asked us to come for an after school night to parents, which had the response we anticipated, which was almost no one attended. But it's very hard to catch parents. So we explore all avenues, and that was one in the mix. A few parents were there, which is great to be able to reach that number of people. And a lot of the teachers have now heard the contents as well as Volition adult members. So hopefully the word keeps trickling out, but that wraps up our presentations for this first quarter of 2025.
Which is quite a bit, thank you.
I would
Karen.
say.
Can I just comment on the last one?
Please.
Volition is made up of a youth component as well as an adult component. So we're always looking for adults that have children in the schools and are aware of what the programs are in the school. Also be part of the adult Volition. So anybody that's interested, we're looking for that kind of sponsorship too, because we actually support the youth initiatives in the school as well as the Board of Health. So it's a worthwhile kind of thing in my mind. That's why we're staying with it. But we're looking for adult volunteers at any time as well to fit into that. So if
Yes.
you know of anybody that's interested, just refer them to Megan
Yes.
or Lauren.
Yes, anyone can point you in the right direction. So Megan's the star of the show. She's the coalition coordinator, and she knows all the ins and outs, but we can get you started in the right direction. And it's 12 sectors of the community are on the table, so business owners, parents, grandparents,
Fire
health
department,
professionals.
Police department.
So there's a
some-
seat for a
some
lot.
religious, some churches involved with that, some of the local churches. So.
Yes, thank you. All right.
If there's nothing else for their presentations in education, we'll go to environmental health.
All right, environmental health updates. So you'll see on the first page of your Franklin Health Department Board of Health report here, we have a overview of quarter one inspections. So this is very typical that the majority would be our routine inspections. We have all of the licensed food establishments within Franklin to inspect throughout the year. So 55 of those have occurred in quarter one. 16 is follow-up inspections, so if they had violations that we needed to follow up on and made a secondary visit to close the loop on that, those are those 16s. Pre-inspections for those getting ready to open and making sure everything is squared away. Complaints, so if a citizen complaint or official city complaint comes in, we follow up on those. And then mobile and transient, typically those are tied to an event. So Recraft and Relic took place, and that's what those 6 were at. There used to be a time that the winter months were the off-season of food trucks, but that trend is long gone. As you probably may have noticed in the report, our mobile license and inspections are up 104% over the last 5 years. So times are changing, and environmental health is more busy than ever before. That gives you a quick glimpse into some of the things that we have been up to with that program.
Okay, does anybody have any questions at all?
Did you say the mobile, like food court, food trucks?
Food trucks, yep.
Any comments? If not, we'd be looking for adjournment. I love running these meetings.
I'll make a motion to adjourn.
Second.
Any discussion? Hearing none, all in favor of adjournment, say aye.
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 Opposed? Okay.